Dr. Katz, it's Willie Geist. Thanks for being on this morning, and thanks for all you've done, the sacrifices you've made. As Mika mentioned, you contracted coronavirus, and you are back in now the emergency room working after your recovery. Can you just talk a little bit about how you contracted it, what it was like for you to have it, and what it's like now to go back, and just a snapshot of what it's like in a New York City emergency room right now? We talked, a month and a half ago about the chaos and the lack of PPE and the hospitals being swamped in some regards. What's it like now?
So I think first, I don't know exactly how I got the coronavirus. I was a New Yorker, so I live and work in New York, and so I could have gotten it anywhere the community spread, but most likely got it at work in the emergency department, probably honestly from touching a surface and then touching my face inadvertently. I think we forget how easy it is to contract the coronavirus from a surface alone, and that's why we do encourage masks even outside on a regular basis. As far as getting the virus myself, I was one of the lucky ones. I was able to recover at home safely. I was able to monitor my symptoms, just taking things like Tylenol or Motrin and drinking some fluids. I never really lost the ability to treat myself. I didn't need any oxygen. I didn't need to go to the hospital. In New York City, we're seeing the evidence of the social distancing and really the objective metrics that we're following to understand how to address this disease from a public health perspective. We're seeing our numbers of hospitalizations go down. We're seeing our numbers of intubations go down. And we want to remember that this was always our goal, to flatten the curve. So we didn't overwhelm our health system. We can get our testing up to date. We can get our tracking up to date so that we can continue to start to relive this new normal. We always knew that we would get a little overconfident, if you will, once we saw the numbers coming down. And that's what we're seeing in New York. But I'm so proud of the work that the New Yorkers have done in really addressing this virus from a true public health objective measure that's consistent and allowing us to move forward to the next phase of treatment.
So, Dr. Katz, as you've seen those hospitalizations go down, thank goodness, that's great news, and that's because of all the social distancing you talk about. What is the view from inside an emergency room? I have friends, some of them you may actually work with, who work in the emergency room, who work in the ICU, who were texting me and telling me of the horrors they were seeing and that they were totally unprepared and they didn't have the equipment they need and everything else. I've seen those stories come down a little bit, that at least you have the equipment you need. What does it look like to you from inside that emergency room?
So when this virus hit New York, it hit us hard. It hit us everywhere, but worse in communities of color, in lower income communities, and hospitals that had less resources. And we were in a very, very bad place. We had limited capacity. We had to upsurge our beds. We were wearing our PPE to the nth capacity, dealing with mask shortages and making sure that we never got to the point we didn't have anything to wear. That we are past that now because we've been able to really get the number of cases down. And that's why the new guidance is to have 90 days of PPE in your hospital. But I don't want to minimize how close we got to true capacity. And one of the things that the doctors in New York City are trying to get the rest of the country to understand is you don't want to get to where we were. And we don't want to get back there again, because that was nothing we ever want to do ever again.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.